Have you ever thought about what that painful bump on the side of your foot is, or why it got there, or if anything can be done for it? Keep watching for some answers. Welcome to Suite 250 at Cool Springs Foot Care. I'm Dr. Lance Reeves, and today we're going to talk about bunions. A bunion is known as a disorder called hallux valgus, which means your big toe is deviating laterally or towards your lesser toes. Bunions can be caused by a lot of different factors. One of those is genetics, meaning if mom or dad had a bunion, there's a chance that you could get a bunion as well. A lot of my patients ask, my mom or dad had a bunion when they were 60, 65, 70 years old. Does that mean I'm going to get a bunion? To me, that sounds like a political question, and I send back a political response and say, that depends. You might get one when you're 60, 65, 70, or you might not. But if you do, we can talk about how you can treat it, or some things you could do to help prevent it from getting worse in the future. There are other factors that can cause a bunion intrinsically, meaning the shape of some of the joints in your foot, whether or not there's some ligament laxity or looseness in your foot, and sometimes inflammatory disorders can cause bunions as well. Extrinsically, bunions can be caused by shoe gear or a history of trauma to the area. Clinically, there are several things that patients come in complaining about. One of the most common is it's too tight in their shoes, or there's pain on the inside of their foot. Whenever you're putting a wide foot into a thin shoe, that can exacerbate the deformity or cause painful lesions or different pain points within the foot. Sometimes the bunion can be so bad that the big toe actually goes over or under the second toe, and this can lead to what's called a hammer toe deformity and other painful lesions or different parts of the foot that are going to be really uncomfortable. For these patients, it's not just the case of the bunion, it's also the hammer toe as well. When looking at a patient's bunion, it's really important to get x-rays. Even if a patient says, I don't want anything to do with x-rays, I never want surgery, I still think it's a good idea to have baseline x-rays. The rationale is, if you get a baseline x-ray, you can determine if your bunion is worsening in the future. This is the best way to determine if your bunion is getting worse, because you can take a look at the radiographic angles of your first x-ray and compare those down the line to your second x-ray to see if it is in fact getting worse or not. As far as evaluating the patient x-rays, there are several angles that are important to take into account when looking at someone's bunion. Intermetatarsal angle, hallux abductus angle, proximal articular set angle, distal articular set angle, sesamoid position, metatarsal parabola, and that's just the forefoot angles. That doesn't even take into account the rear foot. So there are a lot of things that need to be addressed when looking at a patient's x-rays. When I start to think about the treatment for each patient, ultimately it comes down to what the patient wants and what they're looking for. If a patient says they don't want to do surgery, they want to do everything they can non-surgically to get this bunion better or comfortable or more functional, then I'm going to do everything I can to help that patient get there. On the other side of the equation, if a patient comes in with a painful bunion of many years, they've tried and failed conservative measures, and it's interfering with their daily activity or preventing them from doing the hobbies they love, they might schedule surgery much quicker than someone who wants to go through more of those conservative measures. Ultimately, the patient has the final decision on all of their treatment plans. My job is to give them as much information as possible to make the best decision for their needs. Now we can talk about some different treatment options. First, we'll start conservatively, meaning things we can do outside of surgery to try to get patients better. One of the first things is making sure that your shoe has adequate space for your forefoot, meaning if there's too much pressure on that bunion, it's going to continue to cause pain. Sometimes patients can just get into a wider shoe, and that will help alleviate a lot of their symptoms. Other times, putting in an orthotic device to help support their arch can actually help the function of the first ray, meaning help support that bunion a little bit better, causing some decrease in pain. The combination of an orthotic and better fitting shoes a lot of times can give patients a lot of relief and hopefully postpone surgery if they think it might be needed. There are some stretching exercises and bunion splints that exist to help with some of these bunion deformities. However, there are not a lot of them that I think work well, and I think it's up to the patient to determine how many of these they would like to try before moving into different treatment options. But again, I'm going to do as much as I can for the patient if they're wanting to do the non-surgical route. I will do the research, I will try to make informed decisions for them and give them the best guidance I can to get them better without surgery. Surgical options exist in many forms. My specialty is in minimally invasive bunion correction. That means that you have tiny 2 to 3 millimeter incisions versus longer 2 to 3 inch incisions. This can involve some cuts in the bone or tendon lengthening to try to straighten out some of those deforming forces to give patients a more natural looking foot that is not going to be as prominent or painful in their shoe gear. What's also unique about this technique is I don't use any plates, I don't use any screws, I don't use any pins. There's no hardware in this technique, and it also allows patients to walk immediately after surgery. This means no crutches, no knee scooter, no wheelchairs. I found this technique really helps with patients as far as decreasing post-op pain, decreasing post-op swelling, and can actually help speed up the recovery time for patients. It's important to note that this technique is not conducive to all deformities. That's why it's really important to see your medical professional to determine if this is the correct path for you. I hope you found some of this information helpful. Again, if you're wanting to go the non-surgical route, I'm more than happy to help you and do everything I can for you. If you're looking to do the surgical route, or if you have questions about if you're a good candidate for minimally invasive bunion surgery, you can call the office at 615-567-5622, or you can visit us online at www.coolspringsfootcare.com. Thanks so much for watching this video. If you found it helpful, please like, comment, and subscribe to our channel.